We'll be looking at the symptoms of ARVC, which is what arrhythmogenic right ventricular cardiomyopathy. So this condition, we actually said that there are different types of what conditions that could affect the heart muscles. And one of these is what the muscles in the right ventricle are being replaced by fat. Okay, so as they are being replaced by fat, sometimes the tissues there could die off, and there could also be scar formation in the muscles of the right ventricle. So this condition, we say it is what arrhythmogenic right ventricular cardiomyopathy. So here we are just trying to streamline the thoughts and look at just the symptoms. If a patient has this arrhythmogenic right ventricular cardiomyopathy, how are they going to present at the clinic? And what is the patient likely going to tell you that what the difficulties they are finding? All right. So some patients are what asymptomatic, and this asymptomatic patient is most of the times when the disease condition is just starting, or sometimes if the patient has a sedentary lifestyle, so they are not put under stress or exercise like that. All right. So sometimes the patients will be having palpitations. They'll tell you that they are noticing that their heart is beating. All right, palpitations, pre-syncope, that's you are wanting to faint. Then syncope, the patient is fainting. All right, then it may be precipitated by exercise. That's what I wanted to tell you guys about this asymptomatic. If the patient is asymptomatic, you put them under some form of exercise like that and see if they can be able to withstand it. Okay. So first presentation in the healthy young individuals may be exercise related this cardiomyopathy. All right, so exercise related. Then we have congestive cardiac failure with or without ventricular arrhythmias, and advanced cases may be misdiagnosed as what having dilated cardiomyopathies. All right. So one thing is this arrhythmogenic right ventricular cardiomyopathy is occurring here, and of course the ventricles can become enlarged. Okay, but then this is not dilated. Why is it not dilated cardiomyopathy? It's not dilated cardiomyopathy because there's involvement of fat. In an ordinary dilated cardiomyopathy, there will be no fat there. All right, so that's how you can just differentiate this word arrhythmogenic right ventricular cardiomyopathy and dilated cardiomyopathy. All right, so I think that's it for the symptoms of this condition. Bye for now.